My name is Steve Aoki. I'm a professor and chief of sports medicine at the University of Utah Department of Orthopedics, and I'm here to discuss our JBJS article titled Capsule Repair During Hip Arthroscopy Demonstrates Restoration of Axial Distraction Resistance in an In Vivo Intraoperative Testing Model. Now, just a brief background, when performing a hip arthroscopy for femoroacetabular impingement, we have to enter the joint somehow by violating the hip capsule. And there's various capsulotomy techniques that have been employed to allow for adequate visualization and access to the hip joint. In the world of hip arthroscopy, we currently debate the necessity of repairing the capsule at the completion of the surgery. And like most controversial topics in orthopedics, there's literature to support both sides of the debate, with more recent clinical studies both supporting and refuting the importance of a routine capsular repair. Now, prior to our study, the literature has lacked any in vivo data supporting the biomechanical importance of repairing the hip capsule when performing a hip arthroscopy. My current practice standard of care is to perform an intraoperative stress exam of the hips by assessing the amount of hip distraction subjected to an axial distraction force. And this helps me understand each patient's individual hip stability profile. In this study, we used that axial distraction data to objectively evaluate the hip axial stability in 3 different states. We looked at the hip prior to any instrumentation once the patient was asleep on the table. Then we did an interportal capsulotomy and then tested the hip with an axial distraction. And then we repaired the capsule fully and then tested it again. Our findings showed that in an unrepaired capsulotomy, it had significantly greater distraction than the intact capsule state. And we showed that by repairing the capsule, that we were able to restore the hip stability to a similar state as the native hip, at least as it's related to the axial distraction stability perspective. From a clinical standpoint, in this in vivo model, we demonstrated that the objective data showing significantly increased distraction in an unrepaired capsular state, which could contribute to the issues related to hip instability and capsular insufficiency after hip arthroscopy. Now, some of the unanswered questions of the study relate to the time zero nature of this study design. The study only demonstrates that at the time of the surgery, that repairing the capsule restores capsular integrity and axial stability. The questions that do remain unanswered are whether the capsular repair maintains that integrity over time. And it also doesn't answer the question as to whether an unrepaired capsule can functionally heal and scar inappropriately over time. These questions need to be evaluated further with studies assessing capsular integrity after it's had enough time to heal. Thanks for your time, everyone.